I'm Angela Flores. I am the lab manager here at the Health District. And on behalf of the Corpus Christi Nueces County Public Health District, we'd like to welcome you here to our Lab Week Symposium. It is our first, so please bear with us and, give us a minute. But we do have some exciting presentations and presenters for you today. And we'd like to thank everybody for coming and to hear the different presentations. And I'm going to turn it over to Raymond Martinez now for our first introduction. Thank you.
So hello, good morning. My name is Raymond Martinez. As she just said, I'm a microbiologist here in the laboratory, and I work in the LRN program with Valerie. And our first speaker today, everyone should recognize for the better part. I'm just going to give you a little bit of background about her education. So Dr. Kim Monofrack, she received her Bachelor of Arts in Biology from Baylor University. She got a Master of Science in Microbiology from the University of North Texas at Denton. She got her Master of Science in Medical Sciences from the University of North Texas Health Science Center. And she got her doctorates of osteopathic medicine from the University of North Texas Health Science Center, Texas College of Osteopathic Medicine. And she did her family medicine residency from the Corpus Christi Medical Center, Bay Area. And she is Texas state licensed and board certified in family medicine. She's also a medical physician in hospital emergency department. And she serves as medical director and alternate local health authority of the Corpus Christi Nueces County Public Health District clinics. And throughout COVID, she was the operations lead for all COVID-19 operations. And I apologize, I didn't expect to get so nervous. But without further ado, I present to you Dr. Kim Monofrack. Thank you.
Yes, ma'am. Good morning. Can y'all see me? How many laboratory professionals do we have here today? Well, thank you. I want to recognize not only our lab staff, but those out in our community. Our laboratory professionals, this is actually a very special week. It's very near and dear to my heart because one of my very first jobs is as a microbiologist. I did work in the lab. I used to have my own microbiology testing and consulting company in a prior life to being here. I know prior to COVID, if we can ever imagine that. So being a laboratory professional, it's something that is dear to my heart. So this is very important. I don't know if many of you guys know, but anything that you put in or on your body has to be tested. And that's what our laboratory professionals do. Anything that comes out of your body, urine, spit, fecal matter, all of that gets tested to make sure. So they touch everything to make sure that things are safe for us to consume, to be in, to use. They also help helping us, diagnose, help to help guide our treatment. So our laboratory professionals are very important, not just in the medical community, but also in manufacturing and everything else that we do. So they are very important. So within the health district, besides what y'all have seen lately, which is COVID, I'm going to talk about other things that they've actually done for the community. So in the normal day-to-day operations for our clinics here, if y'all don't know, we have STD clinics, we have the community health clinic, we have HIV clinic. So they help us do all of that testing here at the health department. It was one of the first time I got introduced to the lab when I started working here 5 years ago. I was very excited that we actually had a lab, and I went to them and I said, what tests can you offer? So they help to do all of this at our very own clinics. Not only that, but just like I said, anything you put in or on your body gets tested. So they test our environmental samples. So your drinking water, your wastewater, all of that gets tested to make sure that it's safe for consumption, safe for us to swim in. So Texas Beach Watch, we actually have a technician that goes out to our beaches and gets those samples. So anytime you see, if you've ever seen in the news or read about the fecal level matters or anything like that, that's what our laboratory professionals can do. Seafood safety, seawater from the oyster beds. So we all know about, if you get a scratch, I'm in the ER, I see that a lot. We don't want Vibrio, that's what is in our waters a lot. So our laboratory professionals also does seafood safety, and then they test for flu as well as COVID, but we also do flu testing here. And that helps to see what our flu numbers are. Since we've stopped masking, our flu numbers have gone up, so they help with our surveillance numbers. But not just flu testing, COVID testing, they test everything. So being in the ER, my laboratory professionals are very important to me to help guide. It's the same thing with here at the health department. They also, you're gonna hear later from our FBI partners, they help to rule out naturally occurring or bioterroristic events. So we had, kind of a, anthrax. How many here remember the anthrax going through the mail, anything like that? That's what our laboratory professionals. But what you guys don't realize is you actually have to have a special lab. We're actually one of 10 labs in the state of Texas that is a BSL-3. So that's a very strict lab. We're able to test those. There's only one level higher than that. That's a BSL-4, and that's when you deal with Ebola. Luckily, we're not there. So, what has been going on the past 2 years, if y'all don't know, is COVID. Our lab has been very instrumental in helping us with our COVID operations. Not only did they help, they performed 35,000 tests, over 35,000 tests. The highest number of tests that we did was just this year, January 2022. They did 14,500 tests. We had a day where we had, over 1,000 people coming in for testing? And the community, people like things fast. And so the lab was working round the clock. The labs in the ERs, or in the hospitals, it's open 24/7. You can order lab any time of day because people come in, they get sick. Well, during COVID, our lab was here almost 24/7. They were here pretty much 7 days a week. There was no 40-hour work week for anybody, really, during COVID. But not only did they help with testing, they helped with our vaccination clinics. They were instrumental in helping our nurses and our public health technicians come in and draw. When you have to draw up vaccines, it's a pretty exacting science. You don't want to overdose and you don't want to underdose. So our laboratory professionals came in 2 hours with the rest of our staff to help draw. So they drew 1,000 vaccines in those 2 hours before we even started. And you know how fast that 1,000 vaccines went? It went in less than an hour. We were vaccinating 800 to 1,000 people in an hour during our mass vaccination clinics. And in order to keep that going, our laboratory professionals, I think they got trigger thumb or whatever, drawing up all of those. So they were very instrumental in assisting us with all of our COVID operations. Whatever we needed, the whole health department, but our laboratory professionals, they were here. Once they were done out in the field, you saw, they still had to do this. We didn't stop doing this during COVID. They still had to do this on top of testing 35,000 COVID tests. So they were here day and night. So they also help with, like I said, our FBI, our Customs Border Protection. So anytime anybody needs to be tested, they're there for them. When our agents need to travel overseas, they can't wait for their test. So we help test them so that they can go on their missions and help keep our country safe, our state safe, our community safe. We also help testing with HCA, with SPAWN, with Driscoll, CCNC, any of our laboratories, because sometimes some labs will have tests, some don't. And in the beginning of COVID, we didn't even have testing here in Corpus. We didn't even have testing in Texas. If you got COVID or there was the concern of COVID, you had to send them to the CDC in Atlanta. And then the state got it. So it took 2 weeks. So by that point in time, did it matter? And then the state did it, and then our lab got licensed to test. And then once we got licensed to test, we were able to get results out in 24, and then once we were testing 1,000 a day, they were still able to get results out in 48 hours, 24, 48 hours. That's how amazing our laboratory professionals are. So that I want all of our lab people to stand up so that we can recognize them, not only our lab, so Raymond, Angela, Valerie, and Rachel, and then also our laboratory professionals in the community. I want y'all to stand up so that we can recognize y'all. And where are y'all from? Del Mar? Thank you. So you're doing the training programs for all of our professionals? Thank you. And so I will hand it over to Angela.
All right, so thank you, Dr. O. We appreciate that. And our next speaker is going to be Denzel Otakunrin. He is he's one of our public health administrators here, and he is over the laboratory. And he was born and raised in Dallas, Texas. He's part of the Protection Division at the Corpus Christi Health Department with a background in biochemistry from Baylor University, with a master's in public health from the University of Texas Medical Branch, with a focus on epidemiology. He played a key role in the COVID-19 pandemic in conjunction with PHEP to ensure proper case surveillance follow-up was conducted. In addition to this, he had provided both health and non-health entries across Corpus Christi with the latest up-to-date information on infection control practices to mitigate the potential spread of COVID-19. He has also been a co-author in an MMWR CDC article related to COVID-19 UK variant B117 in March of 2021. So without further ado, I'd like to welcome Denzel Otakunrin.
See, I wasn't expecting the applause, so. Thank you. Good morning, everyone. How's everyone doing? Doing well? Awesome. As everyone's mentioned, my name is Denzel Otakunrin. I'm one of the public health administrators for the Protection Division of the Corpus Christi Nueces County Public Health District. As everyone is aware, this week is Medical Laboratory Week, a week where we celebrate and acknowledge our laboratory staff, both within the health district and outside the health district, for everything you guys have done for us and continue to do for us on a day-to-day basis. I do want to apologize. This presentation, it's kind of going to be overlapping with a little bit of Dr. O's presentation, but it's never too bad to have a refresher. As I stated, this presentation on my end will be more like an introduction to what our health district does, our health district laboratory does, as well as what they provide for us in terms of services. So I want to start off specifically with a little bit of a history lesson on science, all the way going back. On the left side, you can see that there's a picture of a scientist in the lab in Paris, France, date unknown. On the right side, you see famous Polish-French scientist Marie Curie, who is known for her work with radioactivity. And little did anyone know that she was actually one of the first women to receive her Nobel Peace Prize in, I believe, 1903. Then going on to the next slide, this is a picture of a brass microscope, and this is, I believe, this is the biocular model of the brass microscope. And on the right side, we see famous chemist Dmitry Ivankovich Mendeleev, developer of the periodic table of elements. And then in this picture, this is a picture of a woman working in Czechoslovak laboratory in 1950. And now I want to introduce the lab for everyone from left to right, top to bottom. Angela, Valerie, Rachel, Renee, Jolynn, Stephanie, and Raymond. Each and every one of these individuals have done so much for our health district. And once again, I do want to give you guys a round of applause for everything you continue to do for us. This lab has played a major role in the multitude of operations that are performed on the day-to-day of the Corpus Christi Nueces County Public Health District. Actually, some of the things they have done have included things such as helping set up our second Panther. Now, the Panther is actually is responsible for a multitude of the COVID-19 testing that we had to do, the mass COVID-19 testing. So those drive-thrus that we did, thousands of people in a day, this machine, as well as the other Panther, had done so much in keep making sure that we're keeping up with everything that's been going on. And then the next equipment we had, our Magna Pure 96, which is responsible for nucleic acid purification. And that is a method to purify DNA, RNA, or protein, as well as to increase our lab efficiency and ensure that once these molecules are isolated, we're able to perform proper testing and ensure that the result is pure. And down the right here's the second Panther again, prior to it being fully powered. Yes, thank you. And not only does the lab do testing and things of that sort, they also do participate in a bunch of trainings. As you can see in this picture, this is the lab participating in the first responder training with the Corpus Christi Fire Department. As well as they did participate in CPR/AED training recently within the health district. And as I said again, these individuals have done so much on top of just COVID-19 testing. They've done testing with environmental samples. They've done testing with seafood safety. They've done testing with the beach water. They do testing with water testing. They do everything, and it's incredible how they keep up with everything. I don't even know how. I don't even know. But then going on to the next portion, I want to focus on, the lab also goes out to schools and teaches the future generation of young scientists potentially, all the information that they might be interested in case they want to be scientists in the future. And I think that's really cool. Stuff like this just brings a little warm feeling in my heart. And then, as Dr. O has already mentioned, they do participate in the Texas Beach Watch. And Texas Beach Watch, or the TBW, it's conducted through the health district to test and analyze marine water. And when you're testing and analyzing marine water, that's what's responsible for the advisory signs that you see out when you go on the beach. The reason why those signs are out there is to ensure that if the bacterial levels are too high or too low, if the bacterial levels are too high, it's to make sure that that if you go out there and the bacterial levels are too high, that if you do go out there, there's a chance that you can get something. So it's very important that you keep an eye out on the GLO, keep an eye out what they're providing, because they're making sure that they're keeping our community safe, And then next, with the clinical laboratory, they're responsible for services such as STI testing, influenza surveillance, as mentioned earlier, and environmental testing. And some of the STIs that they might test would be STIs or sexually transmitted disease, can be like gonorrhea, chlamydia, etc. And then moving on, I want to talk about seafood safety testing, which is one of our environmental testing that we do. So with environmental testing, the lab also does, as I mentioned, seafood safety testing. And this is to ensure that the seawater that is tested that's used to help the shellfish grow and nourish doesn't contain any contaminants that would affect us if we were to consume such shellfish. And then moving on, this is the lab when they were doing their water testing. And this is drinking water. And this is usually taken from regional public and private water systems to look for any possible contaminants. And then going on to the BSL-3, otherwise known as the Biosafety Level 3. This is the test for any exotic agents, and this can be things such as yellow fever, West Nile virus, anthrax, botulism, a multitude of dangerous diseases that they work with on a day-to-day basis. Certification is required to operate within the BSL-3. Even I don't even have certification yet, but that's usually done through extensive FBI background checks. As I stated earlier in this presentation, the laboratory personnel have been trained in the highest degree and perform a multitude of duties on a day-to-day basis. And I can't thank them enough for what they do for the health district, but not just for the health district, what they do for the city of Corpus Christi, Nueces County, our community, to make sure on the day-to-day basis that we're kept to be safe. And again, as I'd like to mention, my name is Denzel, and I hope you enjoyed my presentation. But like I said before, I am astounded by everything that the lab does, as well as the personnel do.
Good morning. I'm Rachel Rios. I'm the clinical lab supervisor in the health department laboratory. And today I have the honor of introducing the Customs and Border Protection Supervisory Air Interdiction Agent, Dan Jordan. Dan is originally from Oregon and graduated from the Air Force Academy in 1999. He attended Air Force pilot training at Laughlin Air Force Base in Del Rio, Texas, and later became a certified flight instructor. In 2007, he became an Air and Marine Operations Air Interdiction Agent in San Angelo, Texas, flying the Cessna Citation Interceptor. I hope I'm getting all these right. In 2013, Dan was promoted to Supervisory Air Interdiction Agent at the AMO headquarters in Washington, D.C. And in 2018, he moved to the National Air Security Operations Center in Corpus Christi, where he flies the Lockheed P-3 Orion. Dan has been married for 21 years and has 2 kids attending school in the Flower Bluff ISD. Please join me in welcoming Mr. Dan Jordan. Thank you, Dan.
I'm going to apologize right now. I'm not used to using a microphone. Usually I'm just really loud. All right, so as Rachel mentioned, I'm Air Interdiction Agent, Supervisory Air Interdiction Agent Dan Jordan. That's a fancy way of saying I'm a pilot and I'm a federal agent. So I'm going to start off with telling you a little bit about what Air and Marine does, because nobody knows. I'll tell you about who we are and what we do, and then I'll move into how the lab here, although they didn't put any handcuffs on anybody, they were responsible for $4.1 billion worth of cocaine seizures. Couldn't have done any of that without this team right here. So to start off, a little bit of history. I was a history major at the Air Force Academy. I know that's weird. Normally those guys are all scientists and engineers and stuff. So in 1789, right at the beginning of the country, our roots started with U.S. Customs Service. Congress started out by saying, we don't want bad stuff coming into our country. That's really where we started out. I'll let you read the rest of the slide if you want, but it basically involves a couple of reorganizations and a name change or two. Now we are Customs and Border Protection, and under that is Air and Marine Operations. Please. Okay, so under Customs and Border Protection, there are basically 4 operational components. You have trade. They kind of regulate the legal trade coming into the country. Next one over is OFO, the Office of Field Operations. They are wearing the blue, and you see them whenever you come into a port. So people coming in legally will see the Office of Field Operations. Up there is the Border Patrol. Everybody's familiar, and we always get confused with the Border Patrol. They're wearing green, and they talk to you if you come in between the ports. And then lastly, Air and Marine, we have all the cool toys. There are some of those cool toys now. We are authorized 1,800 personnel. That's not a lot when you consider that we operate 200 aircraft, a little over 200 aircraft, 300 boats, from 77 different operating locations in the United States down to Puerto Rico and the Virgin Islands. So we're pretty spread out. We have locations with 3 or 4 people. We have locations with up to 100 people. Corpus Christi is one of our largest operations. We have over 70 here. Kind of 3 different flavors of air and marine personnel you might see. That first one, an air interdiction agent, as I said, that's a combination pilot and federal agent. I am one of those. We fly the aircraft. The aviation enforcement agents, they operate the cool stuff in the back of the aircraft. We have a lot of neat radar, cameras, everything else in the back of the aircraft to help us find the bad stuff coming into the country. And then lastly, the marine interdiction agents, those are boat guys. We also have a station of marine agents here in Corpus, or actually up in Port Aransas, and they run some pretty awesome boats. They promised me a ride, they still haven't given me one. These are some of our locations. These are some of our locations all the way from Bellingham, Washington, down to the U.S. Virgin Islands. This is where we operate aircraft. And that's where we operate boats, logically. There's water next to every one of those locations. Those are some of our cool helicopters. You really don't see any around here. The closest helicopters to us here in Corpus are McAllen. We have some in Laredo, Del Rio, Houston, San Antonio. And those are our fixed wing aircraft. That one right there is my favorite. It's older than I am. Most of our aircraft are from about 1966, 67, but we upgrade them with a lot of cool toys. So, highlight of my week until yesterday, I was in Ecuador. The couple of days before that, we fired a laser off of this thing just out over the open ocean. So lasers are awesome. All right, these are some of our vessels. The newest one is there, the CIV, the Coastal Interceptor vessel. It has 4 350 horsepower engines on it. So it'll get up and scoot. That's the one I want to ride on. These are some of our mission areas. So moving on from who we are to what we do. Air, maritime, land, law enforcement, that's just a fancy way of saying we fly around. We have the high vantage point, so we're able to see people coming into the country illegally. We also do some investigation in the larger cities. Domain awareness, we have a very good radar network. Back in the 70s and 80s, they called it an aluminum overcast. There were aircraft flying into this country from Mexico, from Cuba, from South America, bringing cocaine into the country. So that's really where we got our start with the aircraft. People were coming in just willy-nilly on boats and airplanes. If you remember Miami Vice, most of you are probably not old enough to remember Miami Vice. The newer movie, American Made with Tom Cruise, that's based on a true story. That was happening, so that's really where we got set up. That domain awareness network, as much as interdiction agents and airplanes, that's what really shut that down. A little bit of it still goes on, but not nearly as much as used to happen. Next one's contingency and national security operations. We have helicopters, we have airplanes. They're really good in disaster zones. So whenever there's a hurricane, we will bring them water, we'll bring them generators, we'll evac people out of disaster zones and things like that. And lastly, my favorite, extended border and foreign operations. So the best defense is a good offense. So we like to try to catch the drugs before they ever even get close to the United States. I'm getting to the point here, so I'll be there in a second. All right, so the majority of our extended border operations don't happen here in Corpus Christi. Every once in a while, you'll see that big, ugly airplane flying around here. If you see it around here, it's doing training. That's pretty much it. It's either training or it's leaving. So we operate down in Panama, Costa Rica. We do a little bit of El Salvador, but that place is pretty ugly. Lately, we've been operating out of Ecuador. We try to get closer to where the smugglers are. They smuggle large loads of cocaine. The biggest one I've seen was about 7,000 tons, so 14,000 pounds of cocaine. I'll let you do the math, but it takes about 1 gram of cocaine to overdose, and that stuff is still pure. So by the time it gets to the United States, it's worth a lot more. It's been cut a few times, so that's enough cocaine to really kill a lot of people in one boat trip. So that's what we're there to try to stop. We do work with other components or other parts of Air and Marine, But that airplane right there does most of that work. All right, the Coast Guard does a little bit of that too, and we work with the military. They help us out with all the intelligence, and they also do the actual interdictions. The Coast Guard is on the surface. When we find a vessel, they come in and throw handcuffs on. Down here in the corner, you'll see our seizures. This is just for one fiscal year, and it's not really representative because if you remember fiscal 21, October of 2020 until September of 2021, we're knee-deep in COVID. So our operations were a little diminished, and even the drug smugglers were a little diminished. The one good aspect of COVID. So they had trouble getting some of their precursor chemicals and things like that, slowed them down a little bit. Not a lot, because you see, we still caught 324,000 pounds of cocaine. That's not just a Corpus operation, that's the entire air and marine operation. A couple other highlights, a lot of marijuana that usually is at the Mexican border. $73 million worth of currency, a bunch of arrests, and that's one of my favorite ones actually, 900 weapons. 900 weapons, that's stuff that would have killed federal agents in Mexico, would have killed the good guys with those 900 guns. All right, so moving along, I didn't bring the map because it's usually not common knowledge, but usually you see the smugglers working from down here in Colombia or up here, the Colombia-Venezuela border, and they'll move north. They'll move the cocaine up towards Mexico where it hits the land, and then it moves up that way. So like I said, we try to catch it when it's pure. It's still in boats. It's still almost 100% cocaine, and you can get a little bit more bang for your buck. That involves traveling to all those locations. We have to go to El Salvador, Costa Rica, Panama, Curacao, Puerto Rico, and like I said, I was in Ecuador yesterday. Here's the problem. So in March of 2020, I go down to Costa Rica, and the start of the detachment is just fine. I get into the hotel in Costa Rica, everything's normal. I'm eating Costa Rican food. There was some, some scuttlebutt about some virus coming out of China. By the end of the 1 week trip, the hotel restaurant was moving the tables apart, removing chairs, doing the social distancing thing. Of course, us a bunch of pilots, we just pushed the chairs back in there and just sat together. We didn't know what was going on. Really started when I got a frantic phone call from my wife saying, "Hey, I can't buy toilet paper." So I actually stole a roll of toilet paper out of the hotel when I came back. We brought about a pallet load of toilet paper back on the airplane that trip. At the same time, we had an airplane in Ecuador. That one had maintenance problems, and it actually got stuck there. We left the airplane there. The joke was they were going to set up taco stands. It was going to be up on blocks, graffiti all over it, everything. That airplane was there for months. It was stuck and really no hope of getting down there. Because, as you see, Ecuador, back then, they required tests. Now they require vaccination. You can't even get in there with a test. Costa Rica, not many requirements, but Panama, proof of vaccination, proof of a test within 72 hours. So we're stuck. We've got a stranded airplane in Ecuador. We airline those guys back to the United States, and our operation shut down, completely shut down. We cannot travel international, and that airplane can't fly down to where we need to work and then come back to Corpus. It'll fly for 10 or 12 hours. That's not long enough. All right, so we're stuck. We get a phone call. There may have been a tear or two shed, possibly, but we called the health department and asked them for their help, and almost immediately they helped us out. So it started off with a dedicated drive-through test. We tested about 20 of our crew members. They still remember that, the little brain poke. But they all got drive-through testing. They all got results back the same day or the next day, which, as was stated earlier, that's impossible. That just doesn't happen, especially Rachel showed me the equipment they had back then. That involved a lot of work by these guys, and we couldn't have done it without them. So results came back the same day. Those two crews, I was on one of them, those two crews went down to Ecuador. that little operation involved a leaf blower and a lot of Lysol. That airplane had been sitting there for 2 or 3 hours and hot and humid. There had been a volcanic eruption, so it had a layer of ash all over it and everything. No taco stand, but it was still pretty bad. But anyway, we were able to go down there and rescue that aircraft, and then our kind of testing program started in earnest. They call me Dr. Dan at the office now because I'm an EMT, so they're like, okay, that's close enough, you're whatever. So I started giving tests, and I became the most popular guy in the office because weekly I was shoving Q-tips up people's noses all the way up until their nasopharyngeal area. So yeah, I was popular, it was great. But we started testing every week, and results like clockwork, the same day or the next day. It's been amazing. And the only reason we were able to do that, starting in June of 2021, was because of these guys' hard work. So they were at it from 6 in the morning until 10 o'clock at night. I'd get an email at like 10 o'clock, 11 o'clock at night with all my PCR results. And it was just unheard of. Couldn't do it anywhere else. There was no doctor's office, no other lab. There was nobody else who could do this for us. And without those PCR tests, and then later with their vaccination program, we would have been out of business. So this number, wrong button, sorry. That number down there, 757 PCR tests, that's only that fiscal year. If you take the time before that and the time after that, they're up around 1,000. So a lot of those were manual. Some of those were very late at night or very early in the morning, but lots and lots of tests they ran for us. And so the results of that, again, just one fiscal year. This is the total number for air and marine operations. That's just here in Corpus. That is just the operation that was enabled by this lab. 79,000 pounds of cocaine. Again, you do the math, 1 gram's enough to kill you. 79,000 pounds of cocaine did not make it to the United States because of the work of this lab. Marijuana, 13,000 pounds, we call that personal use in this airplane because it's just, that's a drop in the bucket compared to what we usually see. Apprehensions, 89, so this is all your boat drivers down there smuggling cocaine farther north. And like I said, total narcotics value, $4.1 billion. We went into the cartel's bank account and made a withdrawal of $4.1 billion, all thanks to these guys. That would have been zero without. Right, so that's all I have. Does anybody have any questions? If you do, go ahead.
Yeah, I understand the Navy transitioned their P-3 Orions to 737s. Is there any chance that you all might do the same thing as well?
No, sir. So not that we don't like them, they are very shiny and they are very new, but we operate on a shoestring budget. That's why we have airplanes that are older than I am. So there has been talk of possibly getting something a little newer, a little faster, a little shinier, but again, we usually get the scraps. So we'll get somebody else's used airplane. We'll fix them up and we'll make them work. We have folks on the airplane. We have one flight engineer who's 75 years old, and he's been doing this same job since he was in the Navy. He's been out looking for Russian submarines. Now he's looking for Colombian submarines. It's the same thing. A lot of our sensor operators are the same way. So they take that 60, 70-year-old airplane and make pancakes with it. They're amazing. They do really good stuff with very little. So, all right. I'll be over there if anybody has any questions afterwards. Sorry, one more question.
Sure, I just have a comment. With all that money that you all bring in, does it that they don't help you all with equipment or anything that you all need? I mean,
They do, but that money gets spread out amongst all of CBP. So most of that seized money doesn't make it back to us. It might go to Border Patrol, it might go to field operations, but most of it doesn't come to us. To give you an idea, Border Patrol has about 25,000 agents. The Office of Field Operations about the same, about 25,000 agents. Air and Marine Operations, 1,800 total. If you take away the administrators, we're at 1,300 or 1,400 agents. So we're a very small part of this operation. Usually the aircraft we get, they're either seized from the bad guys, we took them back from the bad guys back in the 70s, or we've done some sort of acquisition for that. Okay, thank you.
Hello, my name is Valerie Reguenes. I'm also a microbiologist with the Health District, and I work with Raymond in our LRN lab. But please help me welcome Special Agent Chris Molite. He graduated from the FBI Academy in 2009 and was assigned to the Houston Division Corpus Christi Resident Agency. He works primarily national security investigations and has collateral duties to include Assistant Weapons of Mass Destruction Coordinator for the Corpus Christi and surrounding areas. Today, he is also joined by Task Force Officer Lee Galloway.
You want to give me a microphone?
Or we can set it if you.
Hey, good morning, everybody. Like Valerie said, my name's Chris. I'm with the FBI office here in Corpus. And my presentation is not as cool as Dan's. I'm going to say that right now. But we do have a very patriotic picture right there that I can show you. But so I'm an agent here. I investigate all different kinds of matters. But part of my job is Assistant WMD Coordinator. So if there's an incident or suspected incident here, we handle it. We also have a full-time agent in Houston. His only job is WMD. And then, outside areas, the satellite offices have a person that steps up if we need to. So we really rely on the police department, the fire department hazmat team, and the lab to help us out here because I'm not a scientist, I'm not a hazmat person, I'm an investigator. So our job is really to find out why somebody did something. Not all the science behind it, but just trying to figure out, is this person a terrorist? Is this person trying to kill someone? Is this person trying to kill themselves? Which is what I'm going to talk about a little bit today. We had an incident a few years ago, and when Valerie asked me to do this, I thought this was a good example, even though it's a few years old, of kind of what we do, because we get a lot of white powder letters, suspected ricin incidents, a lot of bomb threats, hoax bomb threats that we deal with. So I'm going to talk about 2 suspected suicide by ricin incidents from, I think it was 5 years ago. It kind of all blends together now, but it was some time in the past, and we work with the lab and a bunch of people for that. I don't think I need to tell anybody in this room what bioterrorism is. I actually stole this presentation from the guy that's the full-time person, so this isn't my handiwork. So there's a lot of words in here that I wouldn't use, but obviously we're working on terrorism events. That's one of our main focuses. Is does someone have these items in their possession because they're terrorists? And that's really like the main thing we're worried about with WMD. Again, I don't think I need to define this for anybody here. So you can see the different criminal violations that we use. The WMD statute there, Title 18, USC 2332, that is used more often like in an actual terrorist incident, like if somebody sets off a bomb somewhere. A lot of these cases that we work don't end up getting prosecuted. You can see down there they amended it in 2001 to include possession without legitimate purpose. So if somebody just makes ricin just because they want to see if they can make ricin or just make anthrax because they think it's cool, we can charge them under the statute. This kind of just defines it a little bit more. Possess for use as a weapon, or threat or threatens to do the same. So you can even just say, like the hoax letters with the white powder that say, hey, here's some anthrax, we can charge them for that. This is a fancy chart that I don't really know what it means, but it shows you what the breakdown of FBI headquarters. So if there's an incident here, like we just had, I think it was a year and a half ago, there was a lady in Canada who sent ricin to the president, and she sent it to a couple other places, to include the Brooks County Sheriff's Office. So we had to deal with that a little bit. And when something like that happens, we have to get on a phone call. So I have to call the guy in Houston and tell him, and then we get on a phone call with a bunch of scientists in DC, FBI headquarters, and we tell them what happened and tell them kind of what's going on, and they give us advice. So this kind of tells us that. We use the fire department hazmat team tests it for us. They tell us what their readings are. We bring it to the lab. I actually the lab gave me some cool paint cans with hazmat stickers on them, and I leave it in my truck. And so far, nobody's broken into my truck. I think that it's a deterrent to keep people from breaking into my truck. Okay, so the first incident was October 19, 2017. I think this was from the news, this picture. But this is a lot of words to say that there was a 19-year-old kid who decided he wanted to commit suicide, and he Googled how to commit suicide and saw that you can make ricin and kill yourself, and it was not reversible. So he bought, I think this is the one that bought them on Amazon. Yep, he ordered some castor beans on Amazon and didn't process anything, just ate the beans. Just ate like 6 beans, and then called his friends and told them, and I'm trying to kill myself, I ate some beans. And started having a little bit of symptoms. His friends came over. They actually flushed the stuff down the toilet so he couldn't use it anymore. He started to feel bad. His stomach was upset. They took him to the hospital. Yeah, so he had no criminal history, no affiliation with terrorist group. He just was trying to kill himself. He was not charged with anything. He ended up recovering. So he got lucky. We all got lucky in that incident. And then what's kind of crazy is 2 weeks later, and I love this slide because I just got like, seriously, you're going to put my name and my phone number in this presentation in Houston, but I left it in here. So this was like 12:15 in the morning on October 31st, so Halloween night. This very similar incident, another 19-year-old kid decided he wanted to kill himself, and this kid did the same thing. Googled how to kill yourself, found that ricin was not reversible. He wasn't going to hurt anybody else, and he attempted to actually make ricin. So he didn't just eat the beans, he attempted to make it. I'll talk about that in a second. And we got a full police department response, hazmat response, and the police were freaking out. What I think I said in there, yeah, they're freaking out. They were freaking out. I would too if I thought I was exposed to ricin. So what's interesting is when this happened, everybody thought they had to be related events. Like, oh, it's 2 19-year-old kids in the same city, 2 weeks apart, attempt to kill themselves, like very similar details. And I told them, well, the one kid was in Flower Bluff, and the other kid was in Cal Allen. That's like totally different from Corpus, like totally different cities, and unrelated. Just really weird coincidence that it happened so close together. And this was really bizarre for me because, this was before COVID. So when we went, we had to go interview this kid who was in the hospital. He was in the ER. I don't know if anybody here may have been involved in this incident, but he was in the hospital. His parents were kind of quarantined separate from him, and we had to go interview them, and we had to put on full PPE, which at that time that was crazy. Now it's probably just like a regular Wednesday for everybody here, but back then it was like I was an ET, going through the. But it was a pretty crazy situation because talking to the doctors, and we talked to the kid about how he made the ricin, and it sounded like he did it right. And everybody we talked to said he actually manufactured ricin, and he has 24 hours to live. So that was kind of the assumption we had. Then he put chocolate milk into it to drink it, so it tasted better, cleaned it all up, but then again he called his friends and told his friends. He was upset about his girlfriend who broke up with him. Unfortunately, his parents were there, so his parents had to get the full, decontamination. They were separated from him in the hospital. And he recovered. Like the kid somehow, he must have screwed something up, and the kid fully recovered and is okay. I left everybody's name out of this because it's a small town, and I just wanted to keep their privacy. There's a quote from a doctor that I think it was in the newspaper. So this is like kind of what I was talking about earlier, just a close coordination. So the people who collect and analyze it and law enforcement intelligence data, we really, there's Lee over there and myself are the people from the FBI who are going to respond. So it's not like you see in the movies where there's 500 people showing up and taking over the scene. Now that can happen. We have tons of resources that are available. It just doesn't happen right away. It'll take a long time. So we really, really rely on the lab personnel, fire department, the hazmat teams are awesome, and the police to help us secure those scenes. And that's one of the coolest logos I think I've ever seen in the FBI, which is our Houston WMD. I'm not responsible for that, but that's pretty cool. So I know I went through that presentation pretty quick, but I just thought it was kind of a good example of what we do with the WMD program here and how we work with the lab in the past, even though it's a little bit dated. Does anybody have any questions for me? No? Wow. Okay, cool.
So we'd like to thank all of our presenters again for coming and sharing their stories. I'm not sure if they're going to stay around a little bit afterwards, but if you didn't want to ask your question right now in front and you want to talk to them for a little bit, I think they're going to hang around for a minute. You can try to ask them then if you have any questions. We thank y'all all for coming out. This will conclude our symposium for today. We appreciate it. Make sure you take your goodie bags. Yes, ma'am.
We do have Laura, she's a representative with Peace of Mind. She wants to hand out some gifts for the first.
Oh, okay. Thank you, Laura, if you'd like to come up. We were able to speak with this company, and they wanted to give a thank you to our presenters and present y'all with a goodie. I'll let her present that.
Hi, I'm Laura from Peace of Mind. I'm a massage therapist, and we wanted to congratulate the sponsors.
The presenters for
presenters. So we gave them a $50 gift card to Peace of Mind, so they could go get a massage and relax. And
Thank you.
And you are the presenters.
Those two right there and these two right here. Thank you so much. We appreciate that, and all y'all's work that y'all did throughout too, and coming and sharing with us. I'm sure Chris and Dan's wife will appreciate that. They'll be very happy. But again, if y'all have any questions for the presenters, y'all can feel free to ask them afterwards. And take your goodie bags, and we appreciate y'all being here. Thank you so much.